Lamin Hassan strongly believes in second chance, that people, despite who and what they are and what they do, good or bad, deserve a second chance. That belief led to the formulation of an organization called Second Chance, the Gambia. The aim is to create a community of restoration for all those who are involved and affected by substance abuse and crime. Sensitization has been one of the greatest tools of this campaign.
But our ultimate goal is to establish a rehabilitation center in the Gambia where people who are struggling with drug addiction can go and get treatment and support, to reintegrate back into society and live a productive life.
There is a gentleman in the Bible who said to God, "Am I my brother's keeper?" Of course, the answer is obvious to all of us. We must look after each other. This determines what we do and what we do not do. This philosophy is known as the doxology of leadership, the summary song of leadership. Number one, we must value people. People must be valued because people are created in the image and the likeness of God, and they are crowned with glory and honor. Number two, we must look for ways to value people. Number three, we must think of ways to value people. Number four, we must intentionally do something that shows that we value people, like this event today. And finally, we must encourage others to value people.
Second Chance the Gambia, with support from the Drug Law Enforcement Agency, recently gathered health and social workers to educate them on a therapy, a treatment which helps to reduce the withdrawal symptoms of drug addiction and different health conditions, including stress and depression.
So today we are here to understand how this treatment works. There will be a practical demonstration of the treatment, and we hope to use this to support health and social workers who are working directly with people struggling with substance abuse.
The therapy was developed by Nick Siegel, a British and psychologist who volunteers to support the philanthropic work of Second Chance the Gambia.
I've got a background in psychology and addictions. I've been working in that area for the last 23 years. Prior to that, I am an ex-user also, so I'm coming from an experiential background. I developed a treatment back in 2000. It's now called AcuStim. It has many names. It's a combination of traditional Chinese medicine, so it's like acupuncture points, combined with Western medicine known as TENS. It's an abbreviation, TENS. It can get complicated, the explanation. It stands for trans-electrical nerve stimulation. It's a combination of these two treatments, so it's a biophysical, biochemical intervention which helps relax the body and bring about relaxation on a neurobiological level.
The battle on drugs requires a balanced approach between supply suppression and drug demand reduction, said Usman Sediba, thanking Second Chance the Gambia for their foresight to help support drug addicts in their recovery process.
Prevention, treatment, and care, harm reduction, alternative development are very essential features of the crusade on drugs. So this program is a manifestation of our commitment to ensure that we are able to capacitate people with the requisite knowledge and skills that are required or that are needed to provide adequate services, because there's a big gap when it comes to provision of services. Second Chance the Gambia, this is not the first time that we've partnered with them. Since 2014, we've had several other programs with them.
Stress and depression as a result of drug abuse is a common feature in the country. Second Chance the Gambia says it is determined to combat. Louis Mendy, GRTS.